All right, what I'm going to demonstrate is a grade 3/4 anterior-posterior TibFib mobilization. You'd use this mobilization for a patient who has had an inferior or an inversion sprain or high ankle sprain. And so you would want to make sure if they have this kind of sprain, you would follow the Ottawa ankle rules to ensure that they are not in need of a radiograph. And if they don't have any of those criteria, such as the posterior fibular or posterior 6 centimeters of both malleoli, the point tenderness of the fibular head, the distal fibular head, then let me think of it just a second.
I thought it was because it's the knee one that I always miss.
So it's the, all right, so we'll start the ankle rules again. So it's the posterior malleoli, the posterior 6 centimeters for high ankle sprain. And then the proximal fibular head. Then also they are unable to ambulate at least 4 or 5 steps. So, and then a lot of times if it's an inversion sprain, they add in the Ottawa foot rules and add in the point tenderness of the navicular and also at the base of the 5th metatarsal. And so if they don't meet any of those criteria, then they don't necessarily need radiograph. Anyway, we are here to do the distal TibFib mobilization. And so I have my patient on the table, and what I'm going to do is stabilize here on the medial side of the tibia, and use my thenar eminence right here at the base of of the malleoli of the fibular side. And to get a grade 3, what I want to do is stabilize and go through the tissue, and it's a larger amplitude and going into the tissue for grade 3 to get that mobilization. And if the patient can actually withstand this grade 3 mobilization, I could progress her into grade 4, which is actually staying all the way into that tissue and working at a smaller amplitude, but a faster rhythm. And so this will help increase that movement of that fibular head, because when you invert, then that fibular head moves anteriorly, and what we want to do is get that fibular head to move most posteriorly and help mobilize and increase the movement to increase dorsiflexion, because that edema can definitely build up, and we want that mobilization to occur. So that is the anterior-posterior grade 3, grade 4 mobilization for inversion sprain or high ankle sprain. Good job.